purpose of this presentation is to discuss the importance of evidence-based practice within healthcare. Evidence-based practice impacts safety and quality of nursing and is listed as Quality and Safety Education Competency, or QSEN, for nurses. This presentation will discuss the historical overview of QSEN, goals of evidence-based practice, and how it affects clinical practice and patient outcomes. The purpose of QSEN is to improve the quality and safety of nurses. It's also meant to prepare future nurses to have knowledge, skills, and attitudes needed to improve the quality and safety of their care. It's also to propose targets and competencies for pre-licensure programs to educate future programs, as well as assess the beliefs of educators to which the competencies are in the current education. There are 6 different QSEN competencies, including patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. The topic we'll be discussing today is evidence-based practice. The definition of evidence-based practice, according to QSEN, is to integrate the best evidence with clinical expertise and patient family preferences and values for delivery of optimal healthcare. Evidence-based practice has 7 steps in the process. The first step is to encourage a spirit of inquiry, which just means having an attitude of curiosity. The second step is to start asking questions. This can be in the form of a PICO question, which breaks down the terms used to search for best evidence. The third step is to search for the evidence, and this can be by using medical and peer-reviewed databases. The fourth step is to appraise the evidence, and this is 7 different levels of evidence which are assigned to studies and can be based on the quality of the design, validity, and application to patient care. The fifth step is to integrate the evidence into practice. So how is this new knowledge that we've learned from research going to change current practice? The last steps are to evaluate outcomes and to share results, which means to disperse the results so that change can occur. The QSEN has several goals for evidence-based practice, and it's to ensure that the nurse has just basic knowledge of scientific methods. They're able to learn how to integrate evidence into the standards of practice. They're able to differentiate clinical opinion from research and evidence. And they're also able to describe how the strength and relevance of evidence influences interventions in patient-centered care.
Historical overview of evidence-based practice. Beginning with Florence Nightingale in the late 1850s, she believed that improving patient outcomes came through the use of sound evidence. For her, war was her research laboratory, where she used an epidemiological process to describe the morbidity and mortality of the sick and injured soldiers. Moving forward to 1900 through 1949, nursing research was in the beginning stages. At this time, nursing theory was discussed solely for developing and organizing educational curriculum. In the 1980s, nursing research really focused on patient behavior and how it affected the rehabilitation and recovery that patients went through during illness. In the 1990s, changes in nursing practice began to result from nursing research as the efforts of individuals in the nursing industry and those from outside coalesced to support clinical nursing research. Now, where we are, in the 2000s, evidence-based practice is the current use of research findings to serve as the basis for treatment decision-making. We see this as quality and cost-effective care, health promotion and disease prevention, management of symptoms, adaptation to new technology, and health disparities. The goals of evidence-based practice. According to the American Nurses Association, implementing evidence-based practice in nursing bridges the theory to practice gap and delivers innovative patient care using the most current healthcare findings. Additionally, the use of evidence-based practice also promotes positive patient outcomes, reduces the cost of healthcare by preventing complications, contributes to the growing science of nursing, promotes the incorporation of new technology, increases confidence in nurses' decision-making, enhances critical thinking, and encourages lifelong learning for nurses. When nurses choose to use the principles of evidence-based practice in their daily care to make decisions about their patients' needs, it results in better outcomes, higher satisfaction, and reduced cost for the patients. Implementing these measures, as mentioned previously, promotes lifelong learning and lets nurses strive for continuous quality improvement in their clinical care and nursing practice to ultimately achieve nursing excellence.
Hello, my name is Julissa, and I'm going to be discussing the importance of competency in patients' outcome using evidence-based practice, or EVP. So, implementing evidence-based practice is crucial for healthcare providers as it directly impacts patients' outcome. By us nurses staying up to date with the latest research and utilizing evidence-based guidelines in clinical decision-making can help providers ensure that our practice are aligned with the most effective treatment and interventions. This competency enables us to deliver high quality care that later on results in improvement in patient care and their outcomes. For example, faster recovery, reduced complications, and an overall better healthcare outcome. And by applying EVP, it helps minimize healthcare costs, which avoids unnecessary procedures or treatments that lack significant evidence in need of the patient's diagnosis. So with us nurses, we have to be able to foster this culture of continuous learning with EVP and the skills that is needed to able to develop this skill that we can use with our patients. Hello, my name is Julissa, and the next topic that I will be discussing is the effects of competency on clinical practice implementing EVP. So there has been numerous studies that show that when healthcare workers continue to use evidence-based practice or are continuing to learn how to use evidence-based practice, are able to develop positive patient outcome, which we discussed previously. Nurses that use these skills are able to develop high levels of critical thinking and critical judgment skills that are used when helping making decisions with our patients' care. A research that I found that showed that nurses that have evidence that use high levels of evidence-based practice or are continuing to learn and do research with evidence-based practice associates with patients' level of, like I said, care. It also helped the reduce healthcare cost. It includes also fewer hospital readmissions, short length stays, and highlights the financial benefit of investing in competency training programs that will help nurses continue to be able to get educated with using evidence-based practice. So there was a lot of good outcomes overall, and a lot of increased satisfactions with the patients and as well with the nurses being able to continue to learn and help their patients have a better outcome staying in the hospital.
We're going to be talking about today examples of competency in practice. So one of the main things that we're going to discuss is going to be infection prevention, fall prevention, and pain management. These are a few examples of how we can practice these competencies. So for infection prevention, one thing that we're going to look at is patient-centered care. How will we be assessing the patient and their family and their knowledge about what infection prevention looks like? The next thing would be to talk about the teamwork and the collaboration. So collaborating with members of PT and OT to ensure that interventions are being carried out. Another thing that we can discuss would be safety and how we can ensure that we're putting into practice things like cleaning our stethoscopes or cleaning tools in between each patient. And then utilizing evidence-based practice. So for example, with C. diff, there's a different protocol that is used when cleaning after patients that have had C. diff, the equipment. And then for quality improvement, what we'll do is we'll take a look at a debriefing session, things that we can utilize to help improve this patient's care. And then, of course, we would use informatics. We would take a look at all of the statistics and gather the information necessary to ensure that our interventions for preventing infection is working and going into place. So for fall prevention, again, we're going to be looking around that patient-centered care. So we're going to be asking ourselves and assessing what we need to be doing to ensure that the patient is not at risk for falling in their rooms, and creating a safe environment, and collaborating and using the teamwork to collaborating with whether it be our handoffs to new nurses coming on, or whether it be to our families in the rooms to ensure that they are helping to meet this need. And then ensuring that the environment is safe for the patient, and that we are following evidence-based practice to take part in ensuring that we're utilizing evidence-based issues such as using fall prevention, non-skid socks. That's an evidence-based practice that we put into use. And then we look at the quality improvement and ensure that these interventions are working. And so another example might be something like pain management. So in order to understand how to ensure that we're putting these competencies into practice would be to, again, patient-centered care, asking the patient, like, what is your pain level? Like, how can we manage your pain better? Ensure that the patient is at the center of the care. And then teamwork and collaborating with the physicians and with other nursing staff to ensure that we have a pain management plan, whether it be pharmacologic interventions or non-pharmacologic interventions. And then in ensuring that we're being safe and using evidence-based practice, again, evaluating that the pain medication is going into effect and that's being utilized correctly. And then, again, it's always the debrief towards the end, making sure that we're assessing the quality and the improvement, and then the informatics. And these are some of the main examples of competency in practice.